Are you sneezing, wheezing? Are you just miserable? I can tell you, you are not alone. I am with you. September is peak allergy month, and that is why we are talking with Dr. Joel Gallagher with Cone Health Allergy and Asthma Center of North Carolina about how to manage your fall asthma and allergies. All right, so let's get right to it. Why are we seeing this spark in September?
Well, the first week of September, Tanya, is often referred to in our business as peak week, and that's for a very good reason. We have a couple of things coming together. One thing is all of the kids going back to school, sharing germs, and viruses and colds are a big trigger for a lot of asthmatics. We also have the peak of ragweed season. That started in about mid-August. You might have felt your sniffles getting a lot worse then, and it kind of stays stable through the first hard frost, which, as you know, can be the middle of November. So we've got about 3 months total of suffering from ragweed.
Oh
So those
no,
two
I was
things
hoping you were not going
together.
to say that.
Sorry, I'm not your friend today, Tanya.
But you are, because you're going to kind of help us out. So let's talk about how we can reduce our exposure to these kind of allergens.
Okay. So that's always a really good question that we get. So in a typical day, the pollen levels in the air go up during the morning and stay stable through noon and then go down in early evening. So if you can try to focus your activities in the early morning or the later evening, your pollen levels that you'll be exposed to will be a lot lower. Another good thing to do is to get a HEPA filter for your whichever room you stay in, or just a whole house filter. So that's a high efficiency particulate air filter, and that captures all the pollens and prevents them from interacting with your immune system and causing allergies.
Okay, so we need that HEPA filter in our bedrooms
Yes.
to make sure that we can wake up and
Yes.
feel a little
Yes.
bit better. Gotcha. All right, so let's talk about the difference between asthma symptoms and allergy symptoms.
So this is a common question that we get. So asthma really only focuses on the lungs. So it is inflammation of the airways, mucus production of the airways that really constricts the air movement through your lung tubes. And that causes things like coughing, wheezing, chest tightness, and shortness of breath. Allergies can affect the entire airway from the nose all the way down to the lungs. So people with allergies often have asthma, but they don't necessarily go hand in hand. But
Okay.
patients with asthma are triggered by allergies. So there's a lot of interconnectedness there.
Okay. How can people tell? Oh, so you kind of told the difference about how you can tell the two, but how would someone know if the symptoms that they're experiencing are, let's say, COVID or asthma or allergies?
It is hard. There's a lot of overlap between all of those symptoms. So early in the pandemic, we actually, had a mask mandates everywhere because we couldn't tell if something was COVID versus asthma or allergies. But now that we have testing, we're able to distinguish that a little bit more. So both COVID and asthma and allergies have the congestion, the headaches, the coughing, the tightness in your chest. But allergies and asthma usually aren't presenting with fever. So if you have a fever, that's more likely an infectious process like COVID-19 or the common cold. Also, if you have GI symptoms, that's probably not allergies or asthma.
Okay, gotcha. All right. So once you've determined, let's say that it is asthma versus allergies, what are some ways to manage those symptoms?
So if you're diagnosed with asthma, our main set of treatment options right now are focused on inhalers. So if you have mild asthma, we'll probably just give you something called albuterol or a rescue medication, and that's a short-acting medication that opens those lung tubes up and helps you breathe quickly. And if your asthma is severe enough, we'll put you on everyday medications. They usually consist of inhaled steroids that control the inflammation on the layer of the lungs to prevent all that mucus production and hyperreactivity and inflammation. So between those two treatment options, we are able to control those asthma symptoms.
All right, like anything else, right? Sometimes you know that you're diagnosed with something and you're like, I'm okay, it's mild or whatever. How important is it for people with asthma to have a plan of action?
Oh, the plan of action is huge. Our goal as allergists is to keep you out of the emergency room and out of urgent care. So we provide all of our patients with a written plan on what to do when they start having asthma symptoms. That depends a lot on patients knowing what their triggers are and how they usually present. So we will have patients start taking an inhaler like a albuterol every 2 to 4 hours when they first start having symptoms, and use that consistently for a few days as they get over whatever is causing their exacerbation, such as a cold or a allergen exposure.
Are there specific indoor or outdoor activities that people should avoid this time of year dealing with both of those things?
I think timing is the big problem here. So if you time your activities in the morning when the pollen levels are lower and the evening when the pollen levels are lower, that can help decrease exacerbations. If colds and the cold air is a problem for you, you might want to change a lot of your exercises into indoors. So this is the time to hit up the gym or hit up the indoor pickleball court or whatever the case may be if that's one of your triggers.
Gotcha. Okay. Are there some other triggers that people should look out for besides those ones that you mentioned? Sometimes there's always those hidden ones.
Yes, for sure. So one of the big ones coming up is all of the cold and flu viruses. So the new flu and COVID vaccines were just approved within the last couple of weeks. I just got both of mine today. So be sure to get those. They'll reflect the current circulating strains of those viruses. We also have a RSV vaccine for those greater than 60. And then we have a pneumonia vaccine that's approved for certain populations as well.
Okay. So, arguably you can understand people might be hesitant to go for a run or go to the gym if they're having trouble breathing, whether it's asthma or allergies. Can lifestyle changes like eating habits or something else help with overall respiratory health?
Yeah, I mean, one of our goals is to keep people living the way they want to live, and we definitely don't want to limit physical activity by any means. Actually, weight loss can help a lot with asthma, and so we want people to exercise and lose that weight because all that weight is constricting your lungs and making asthma exacerbations worse. And also, exercise helps us to produce our own adrenaline or epinephrine, and epinephrine is a natural dilator, or it makes your lungs expand, and it can help with congestion as well. So even though it doesn't feel like it in the moment, exercise can help your breathing long term. I
Okay.
don't know about you, but I'm always huffing and puffing while I'm exercising, so it's hard to think about those long term ramifications.
I mean, we're supposed to be, right? We're supposed to be working, so that's okay.
That's right.
Right. All right. Let's talk about some warning signs of an asthma attack, because if no one has had one, but they know that they are having trouble with asthma, they want to know like what that's going to look like, sound like, what that's going to feel like.
Right. So asthma presents differently in different patients. So it's really important for patients to know their own triggers and know how they present. It can present with coughing, with chest tightness, with wheezing in certain people, and knowing how you present is important for the next steps. So if you happen to have a rescue inhaler like albuterol, one good way to tease out whether it's asthma versus something else is to take a couple puffs of the albuterol. It should help in 5 to 10 minutes. So if that's the case, then you know you're experiencing an asthma attack, and you probably want to contact your specialist for further instructions.
All right. Is there like a point where someone should seek medical attention like right then and there?
Yes, we get that question a lot, Tanya. So when we talk to patients, we tell them that if their 2 puffs of rescue inhaler isn't lasting 4 hours and they're having a return of their symptoms, they need to seek further medical attention because it's beyond the point where they can manage it at home.
Gotcha.
So that 4 hour mark with a couple puffs of albuterol.
Okay. Any final thoughts when it comes to asthma or allergies?
Yes, for sure. So if you have to take away one thing from our conversation today, it's know your triggers. So we can help with that. We have 5 locations across the Piedmont Triad. So we can do allergy testing and figure out what might be making your asthma worse. So know your triggers and know how to avoid them.
Gotcha. Okay. And one quick question, because we do have a little bit of
Yeah,
extra time. You and I were talking in the
certainly.
break, and I asked, is there something that we should be drinking that may help with our allergies? And I
I
love
did
this
give you the
answer.
So caffeine can actually help with asthma and allergies. It can open up your airways. Obviously, it has some other bad effects as well that you want to look out for. But if you need another reason to keep drinking your coffee, here it is.
Thanks. I needed that for my second cup of coffee for today. So thank you.